Hello, my name is Chris. I'm a retired Canadian pharmacist. Welcome to this 7-part series titled What Every Pharmacist in Canada Needs to Know About the Design and Teaching of Doctor of Pharmacy degree programs. This is Part 3, Early and Continuous Experiential Education. Early and Continuous Experiential Education, also known as Introductory Pharmacy Practice Experiential Education, is one of the evidence-based teaching methods recommended for Pharmd programs. It spans the first 3 years of the pharmacy curriculum and differs from the 4th-year advanced pharmacy practice training in that it is not full-time training. It's taught in parallel with, integrated with other elements of the pharmacy curriculum. It's common sense that early and continuous experiential education is valuable. I got my degree in pharmacy without ever setting foot in a pharmacy, and it was patently obvious to me on day one of my pre-registration training that I would have benefited from early experiences in practice site settings. A few years ago, I had the opportunity to spend time in Scotland recruiting pharmacists, hospital and community pharmacists, to serve as preceptors for first-year pharmacy students in Glasgow. I spoke with well over 100 pharmacists, and all but one of them were keen to accept a student, to welcome a student into their practice site, and for them to help with that student's education. Their most common comment was that they wished that they had had a similar experience when they were pharmacy students. They, like me, had gone through their university-based training without setting foot in a pharmacy. They saw the benefit of it and were keen to offer to new students what they had not had when they were students. I'd like to be crystal clear that the Pharmd programs in Canada, for the most part, do not offer early and continuous experiential education. What happens is that early practice-based experiences, for the most part, are compressed into a few weeks of full-time training outside of the normal academic calendar. They are taught without any integration with other elements of the Pharmd program. In my opinion, that form of experiential education is limited in its advantages. Again, in my opinion, it's a nice demonstration of a curriculum designed for the convenience of faculty rather than for the optimization of student learning. Early and continuous experiential education socializes students to the pharmacy profession. It gets them excited about pharmacy. It allows them to prove to themselves that they have become welcome and contributing members of the healthcare workforce. It builds competency, it builds self-esteem, and it builds self-confidence. It's common sense that individual students should be paired one-on-one with individual practitioners. It's common sense that individual students and practitioners paired together will form mentor-mentee relationships, and that's important. It's also important to authorize the on-site preceptor to personalize a student's experience. The intent is to keep students just outside their comfort zone and not so far that they have their self-esteem and self-confidence damaged. The idea is that as their comfort zones expand, they'll be able to accept increasing responsibilities, and it is the on-site preceptor who is best positioned to judge when new responsibilities could be added to earlier responsibilities. It's also a good thing for the on-site preceptor to be able to recognize the balance between adding new responsibilities and allowing students to maintain competency with previously learned activities. It's the use it or lose it principle that's involved there. A substantial knowledge base is not a prerequisite for early and continuous experiential education. There are numerous examples of the successful integration of even first-year students into practice site settings. You could argue, however, that practice site experiences might become a prerequisite for campus-based education. Personal experiences drive the learning process. For example, a student with a meeting in a pharmacy with a visually impaired patient can be guaranteed to ask themselves, how can this patient safely manage their medications if they're not able to read a prescription label? It's a simple task to give that student the self-learning challenge of going out and finding for themselves what strategies can be used by vision-impaired patients. The ability to recognize and act on practice-based learning opportunities is the basis for continuous professional development. A student who throughout the 4 years of the Pharmd program has been asked to identify and act on learning opportunities, practice site learning opportunities, can be expected to graduate with the traits of a continuous lifelong learner well ingrained in their psyche. I promised in previous episodes that I would include quotes from the pharmacy literature commenting on Pharmd programs. The quote I have for you today is really based at higher education, but it's written by pharmacists, and I will read it out as I've done before to make sure that I don't misspeak. The pharmacist's writing, quote, express frustration with the cost, effectiveness, and slow pace of change in higher education, including pharmacy education. End of quote. I'll repeat the question I've asked in earlier parts of this series. Ask you to cast your minds back to your time in a pharmacy school. Would you have benefited if you had been given the opportunity on a frequent and regular basis to spend time in practice sites throughout your program with your sleeves rolled up? If the answer is yes, then I'll encourage you to view all parts of this series. I encourage you to talk to your colleagues, talk to your local, your provincial, your territorial, your national pharmacy organizations, talk to your local pharmacy school, talk to the accrediting body, talk to everybody to encourage change. A brief mention of the upcoming Part 4, that will be devoted to advanced pharmacy practice experiential education. Thanks for watching. Your questions, comments, and requests for supporting documentation are welcome.